pretty much like up in the suboccipital region. You started like needling that, and that has really made the condition just almost go away completely.
Hi, I'm Dr. Brian Hutchison, and today we have our special guest is Scott, and Scott and I have known each other for coming up on almost 3 years now.
Yes, sir.
And your journey has been pretty incredible, Scott, and thank you for sharing it with our viewers today.
Absolutely.
And just tell us a little bit about, what led you down the path of looking into more challenging structural health conditions and kind of what got you started to connect with our team.
So pretty much I started getting sick back in 2015, and back then I didn't think of anything like alternative or functional out in that consideration, but I saw all the conventional doctors that pretty much people go to, and I did get a few answers, but it wasn't the answers I was looking for. None of the things that I got diagnosed with made sense to what I was suffering with. It's like no doctor was like, here's why you have this is why it's happening, here's what we can do about it, kind of thing.
Got it.
So over the years, things just kept getting worse. I kept going from like doctor to doctor to doctor. Like I think I saw like almost 20 doctors by the time before I saw you. And it was just getting to a point where I was getting more bedridden, more disabled, less quality of life, until it was like, okay, there's something I really need to do about this.
Yeah, okay. And, just explain a little bit of the symptoms that you had, let's say, developed from 2015 or 16 on to 2020.
So pretty much the hallmark symptoms I complained about were I have like this burning pain, kind of like in my epigastric upper abdominal area, and it would radiate into like my back and then even into like my shoulders.
Okay.
So at first, I think within a week of getting the symptoms, I went to the drugstore and bought some Prilosec, thinking it was GERD, heartburn. I tried that for 5 days and I was like, okay, this has got to like get rid of it. And obviously it didn't. So the next thing I did was I went to primary care. I went to gastroenterologist, and they ordered all the images. Nothing really showed. And at this point, they were like, it's either psychosomatic, you have like this syndrome, you have that syndrome. And I'm like, okay, obviously there's something wrong. I didn't have this for the first 19 years of my life. So at that point I was like, okay, let's seek another opinion. And I saw 3 different gastroenterologists. None really did anything to help the bloating, the nausea, feeling full after you eat, able to take like a few bites, those kinds of symptoms, along with this intense burning pain that just, it's not like a heartburn because there was no like regurgitation. So the difference from heartburn, it was lower down, like whereas heartburn, you feel it like more here. So like I knew after I took that like Prilosec that it wasn't heartburn. It was something else going on.
And when did you first start noticing some of the almost Debarquement type symptoms and the upper neck things where, you get out of your car and you still felt like you were moving, different symptoms such as that?
Yeah, so I think for the people watching, like Debarquement is just pretty much like, they describe it as you get off a boat and you get dizzy and it still feels like you were seasick after disembarking from the ship. So that started after I was in a car ride, and like I was fine in the car, and then after I got out of the car, I was dizzy, and I was like, maybe this is just, I just had a stressful day. And after that, it kind of progressed into this like feeling that like, when you get on the treadmill or like on those like airport like movers, you still, when you get off of it, you still feel like you're moving.
Like you're moving a little.
Yeah, exactly. But that would be like every day, all day for like 2 years straight. It's either like you turn your head a certain way and then it's like, oh man, like the world is bouncing, or like you feel like you turn your head and then you feel like your body's going forward or backwards, something like that. So pretty much the cause of that was pretty much like up in the suboccipital region. You started like needling that, and that has really made the condition just almost go away completely.
That's amazing to hear. So, we had worked together starting up to almost 3 years ago now. And during that time, initially, I was working mostly on getting you a nice cervical spine curve, which we did obtain. You also were getting regenerative injections, and you obtained full spinal stability from a ligament perspective. And at that point, it was kind of interesting because even though you had significant improvement from getting a really good curve, from getting ligamentous stability, you also still had a lot of symptoms. I mean,
Absolutely.
your C2 would go out either every day, every week, and then you would feel those Debarquement Syndrome symptoms where you felt very unsteady, uncomfortable. You felt like you were still moving when you stopped. I mean, it was still a very debilitating type of presentation despite obtaining spinal curvature and ligamental stability.
Yeah, absolutely. And it wasn't like, I knew it wasn't coming from the inner ear too, because with the inner ear, you feel like the room is spinning. Whereas with the Malday debarkment, it's more like you're off balance. It's like that feeling that you're on like a treadmill and like you still feel like you're on the treadmill.
Yeah.
So you're not spinning essentially.
So Scott is an incredible patient because he also does a ton of research, and you can tell he's very, very intelligent. So he probably knows as much about many of these conditions as anybody that's been researching or going down this path.
Absolutely.
But, Scott, so tell us a little bit about once we started to address the tendons, particularly where we started was working on getting that C2 to hold.
Yep.
And just kind of how your life has changed on a day-to-day basis, and how long has it been since your C2 has kind of malrotated or fallen out of alignment?
Yeah, so I think when I first saw you, my C2 would always rotate to the right, and that was like one of the things we would do. And like, of course, we tried the regenerative injections, we tried the curve correction, and I see like this amazing local chiropractor in town, and they give me some of the best adjustments, and don't get me wrong, they're excellent adjustments, and you feel amazing afterwards. But it wouldn't be till like a day, 2 days later that you're like, okay, I wake up and I have a headache, a terrible tension headache for the 5 minutes upon waking, and then I do my computer work and I just have this terrible tension headache all day, and I have to do my job. So,
and you would get that uneasy unsteadiness coming back. And
absolutely. And driving has been like super tough with that condition.
Got it.
Like turning your head to the left, turning your head to the right while you're like making a right on red or something. It's just tough.
So we've done, a handful of dry needling to the tendons in that suboccipital region and a little bit lower in your neck. And now how is it in that area?
It's pretty much like 95% resolved. Like,
that's amazing.
So yeah, like I can finally hold my head up without having like a terrible tension headache all day. Like maybe it'll come on after a little bit of stress, or maybe you overdo it. Sure, it'll come on, but we're still doing treatments. We're still, making progress. Whereas before it would come on within like 5 minutes of waking.
Yeah.
And it would last all day, every day, nonstop kind of thing.
So before it would just be kind of moving, like the connection between muscles in your neck and how you move. Literally within 1 day, your C2 would malrotate again.
Absolutely.
Even with having good spinal curvature, full ligamentous stability, the tendons are what pull the bones into alignment.
Yep.
And so when you have good tendinous stability or strong tendons, then, it's a lot harder for those bones to shift out of position.
Yeah.
Which was really interesting.
And you can do more activities too without making them go out of alignment.
Correct. So yeah, with your good curvature, your good ligamentous stability, you still had to be 100% conscious about everything you did. I mean, you used to still walk kind of like a board, right? Because you were so nervous you were going to throw something out of alignment.
Pretty much, yeah.
And that's no way to live, right?
Yeah.
So, now that we've been really strengthening those tendons, I mean, you're turning better, you're more comfortable in your own skin.
Yeah.
You're able to lift things. Your C2's holding position now for how long has it been since we had to...
Yeah, since the last session, so about 5 weeks.
About 5 weeks, the C2's been holding position, and you're not getting that crazy feeling like, one of the reasons that it's so important to get those suboccipitals strong and healthy through the tendons when people get this kind of pathology is that they do, and I talked about this in a previous video, pull on the spinal dura mater.
Yep.
And so then that can alter cerebral spinal fluid flow. It can alter tons of really important nerves in that area, even maybe cause abnormal signaling to the vessels around there. I mean, you have your vertebral artery passes in that space. And so you can get a whole different variety of symptoms. The proprioceptive fibers are just like dense in the suboccipital. So that's where you're supposed to be aware of where you are. And if those aren't working correctly, I mean, you're going to feel totally off balance and a ton of other symptoms. So.
Yeah, and I think that's a thing that like if somebody's watching here hopeless and they feel dizzy and like they've gotten all the things checked with their inner ears, they've gotten like the brain MRI, they've seen a neurologist, they've done all those correct things. Usually the fourth thing that's missing is those suboccipital tendons that kind of keep, because they move the eyes. And that's what, kind of like keeps the whole system in check.
Scott, tell us a little bit about your low back and when we did our first treatment where we really worked on some of the paraspinals, the deeper thoracic and lumbar multifidi,
Yep.
you know, some of those really important spinal stabilizing muscles. But we work on the tendons because we're bringing strength to the muscles through treating the tendons. You know, what was it that you noticed that day that was like kind of just like an aha moment for you?
So pretty much like my abdomen would be tight. And I remember when I first saw the gastroenterologist, he would always say like, relax your abdomen, relax your abdomen. You're so stressed. You're so stressed. And like, I was like, this is like the most I can relax
You were
it.
trying, yeah.
Yeah, I was trying to relax it. And essentially like when you started dry needling the paraspinals, I think we only did like 3 like needles, and it was like maybe 1 or 2 muscles. And then I was like, oh my gosh, I need to sit up. Like I need to use the restroom, because I almost felt like this huge release of like tension through my gastrointestinal tract.
That's amazing. And so you at one point described to me that even though it wasn't a formal diagnosis, that you also felt almost like a slowing of the motility, like almost a variety of some subset of a gastroparesis.
Correct.
Where once we started to release those tendons in the mid-back and the low back, that you felt like all of a sudden there was this motility.
Yes, correct.
Like you noticed later that you could eat some food and not feel super full after just a couple bites.
Right.
And that, you know, it was really improving that motility.
Yeah.
You and I have, you know, looked into a little bit and how, you know, there's a couple of, you know, reasons of how we can explain this. And we're going to do more in detail in the future. But, you know, basically that when you have an incredible tension in that area, shortening of all those muscles, the deep spinal stabilizers and tension in that area, how it can not only irritate nerve rootlets and also eventually affect nerves that directly go to your abdomen. But that there's a couple other ways that this, you know, neurology or neuropathophysiology can cause the symptoms that you had.
Exactly. And that was kind of like the answer that like I was looking for. And like, I think through both of us, it took a lot of research to like eventually come to that. Cause I honestly like couldn't find it in PubMed, couldn't find it in Google. I couldn't find it anywhere. And I was like, who the heck can like figure this out? And I was like, I think it just like, I think the one message I have for everybody is if you have something and like, just keep fighting, like keep going, just know that there will be a solution out there.
Yeah. And another interesting point, that's great, Scott, and thank you. So, is that typically just in my, whatever it is, you know, 11 years of being a chiropractic physician, the amount of instability that you usually find in the lumbar spine is usually confined to L5, S1, L4, L5, and more rarely L3, L4. Those are the areas that sometimes you'll see, wow, there's a spondylolisthesis, or when you flex and extend, you know, there definitely is ligamentous instability. But it's much more rare to get ligamentous instability once you get up to where the ribs connect. There could be a rib, you know, instability, but it's the spine from, you know, L2 to through your thoracic spine has a ton of support structures, right?
Yep.
The ribs connect there. There's tons of really dense, thick muscles. That area doesn't move as much. Like your low back, and the very low back has a lot of mobility. Your neck has a lot of mobility, but your thoracic spine and upper lumbar spine are pretty relatively, you know, stable. They're not as common to get severe ligamentous injury. And so that was pretty interesting that, you know, even though you were fully stable ligamentously, you still had this incredible tension through the other half of spinal stability, which was the tendons,
right,
having, you know, experienced tendinopathy for years and years and years, and it just being tightness to begin, but over time started to cause abnormal either structural irritation or impingement or interference with the nervous system. And some of those splanchnic nerves that end up going and innervating the gut, and, you know, the celiac plexus was getting irritated. And so you actually could get all of these neurologic symptoms from where those nerves exit when you have this extreme tendinopathy and tension.
Yep. Yeah, because you're trying to stabilize something that isn't like structurally stable, so the muscles will do whatever it takes to clamp down.
To clamp down, yeah, because those tendons don't have the strength to allow normal mobility, which is going to give some space for those nerves. So the muscles will shorten, clamp down, and then they're always kind of tight because they're trying to protect against, you know, the weakness in the tendons.
Right, exactly. Further injury.
Mm-hmm. So tell us a little bit more about, you know, kind of what you've been most excited for with us discovering for you that tendon dry needling was really, really, really significant. I know that now you know, you said at the end of a day, you know, even a year ago, you would feel terrible after work. You know, you would make it through work. Like, you got a lot better from curvature and ligamentous stability, but you still barely made it through your workday. And then you were like, you didn't want to do anything. You didn't want to be social. You didn't want to go see friends, you know, go out. And so, what are you most excited for now that you're, you know, where you are in your health journey and
Yeah.
continuing to get
Just
better?
to, like, you know, do the things you want to do in life, you know, be around friends, you know, be around family, like the things that like matter in life, and also eventually to like help other people who are like struggling with the same things that like I struggled with. You know, it sucks that like go through all these like doctors and not get the answers, and like I'm realizing like, how common it is. Like, you sometimes you just feel so alone because like nobody else is giving you those answers, and then like nobody, and it's like, okay, if the doctors aren't giving you the answers, it almost makes you feel just like alone in this dark world. But
Yeah.
it's just so common. Like, you realize how many other people are like going through the same thing, like once you kind of go through it yourself.
I think that's an incredible point, but I think a very good point for us to make today is that when we do treat tendons, we work on spinal curvature, that we're getting results that are lasting.
Exactly.
I mean, they're really lasting. It's not like it's just, oh, you know, in 2 weeks you're going to be back out again. Like, the only solution is a fusion, or really some incredibly, you know, you need to get bone marrow and really inject it into there. I mean, you've been holding this C2 for 5 weeks, and before that, I think it was also 5 weeks, but it's not out today. I mean,
Yeah.
you're literally, you might hold it forever now. I
Yeah.
mean, it's literally,
Yeah, it went from 5 minutes to 5 weeks.
yeah, within just the past couple of months.
Yeah.
So it's pretty incredible, and yeah, just really excited for you that you're getting so much better.
Absolutely.
Good. Anything else that you want to share with the viewers, or do you feel we kind of covered everything?
I think we pretty much covered everything.
Good. Thank you so much, Scott.
Appreciate it.
Okay.